there, everybody. Thank you for joining us for this live webinar. My name is Taylor Newendorp. I am an OCD specialist and have been for about the past 10 years or so. I've worked in a variety of clinical settings over the years and have been working with OCD as one of their therapists, providing direct services to people all across the United States with OCD for a little over a year now. So that's kind of the first thing we want to let people know. If this is your first time tuning in, or in just case you weren't aware of this, you obviously know that NoCD is an incredible app with lots of great information, education on common signs and symptoms of OCD. We've got this amazing online support community through the NoCD app itself, but we do also provide direct therapy services. And if you or somebody you know seems to be struggling with what appear to be obsessive compulsive disorder symptoms, and you're curious to learn more, you can always click on the link you'll see just below this screen. That will get you set up with a completely and totally free phone consultation with a member of our care team here at NoCD. They'll be able to answer a lot of your preliminary questions about the services we offer and that sort of thing. And then you can set up an appointment with one of our many excellent OCD specialists that are providing services in the majority of states across the US. And just so everybody knows, NoCD is planning to have services up and running in all 50 states across the US, including Washington, D.C., within just another couple weeks now. So if for whatever reason we don't currently provide services in an area where you're located, we will be able to very soon. So I'm here to answer any and all questions you might have about OCD itself. If you want to learn more about symptoms you might be experiencing or other things you've heard about, if you have questions about treatment, I'm here to try and help with all of that. And at any point throughout this webinar, like I said, if you think it might be appropriate for you to pursue potentially setting up an appointment with one of our therapists, then just go ahead and click on the link you see below the screen. So I'll just get to it. I really enjoy conducting these live webinars. I really like hearing from people in the NoCD community just to help provide more clarity on all the different manifestations that OCD symptoms can take for people. I think, unfortunately, there's still a lot of misconceptions, a lot of misperceptions about what OCD and is not, and hopefully I can help clarify some of that. So there's no such thing as a bad question. Ask away. All right, and we've got quite a number of questions already. I'll do my best to get to as many of these as I can. So one of the questions we have here states, I'm suffering from harm OCD, and I'm wondering, is it normal to feel anxious about lashing out? And is it normal to not have any anxiety about the content, but I have anxiety about not having anxiety? That is an excellent question, because you bring up a lot of different points that are really important to be aware of when it comes to something like harm OCD, really any form of OCD. And just in case you're not familiar with what we're calling harm OCD, this is a surprisingly common form of obsessive compulsive disorder. Usually it's characterized by repetitive, intrusive, unwanted thoughts or images, or even sometimes what feel like urges that you might somehow directly or inadvertently cause harm, maybe even death to somebody else. Usually it's somebody in your life that you care about, that you care deeply about. And that is why the nature of those types of intrusive thoughts and images can be so distressing and disturbing to experience. Many people struggle with what we often refer to as either self-harm OCD or suicide OCD. And in those cases, it's kind of a similar theme. A lot of doubts, a lot of urges, a lot of intrusive images and thoughts that somehow, some way you might actually lose control and hurt or kill yourself, when you know deep down within yourself that is not something you would ever truly desire or try to follow through with. So getting back to the question, is it normal to feel anxious about lashing out with OCD? Yes, I would say that's very normal. That's a very common fear, actually. It comes back to this underlying principle that the person might lose control, lash out, cause some sort of harm, do something actually really violent, and sometimes something that the person themselves considers abhorrent. So it's pretty natural with OCD for those types of urges, if you want to call them, to produce a decent amount of anxiety. As far as the second part of the question, is it normal to not have any anxiety about the content, but I have anxiety about not having anxiety? So I'm assuming what you mean there is the content of the actual obsessions themselves. And actually, if you are to receive treatment for OCD and go through exposure and response prevention, one of the goals of that form of therapy, which is the most effective form of treatment for OCD, one of the goals is to get to the point where people can continue to experience obsessions but not experience much in the way of anxiety around it. We want people to start to learn that simply experiencing intrusive thoughts, images, urges, sensations, whatever it may be, these are not actually threats of any kind. This is one of the ongoing tricks of OCD itself. These types of thoughts and images come up so repetitively for the individual, they do start to have concerns that these are actual real threats and they actually need to do something about these types of thoughts and images. They need to be addressed in some way, shape, or form. And unfortunately, that's usually where compulsions and rituals come in. It's some sort of attempt to get rid of those thoughts, alleviate any distress or anxiety that might be associated with them. But we actually want people to get to the point where they can experience those types of obsessions, whatever the content may be, and not experience much, if any, anxiety around it. But what you're describing here is what we would call in the OCD world a backdoor spike, meaning once you are experiencing the same obsessions that used to cause discomfort for you, but there's not much anxiety or distress attached to them anymore, then there's this secondary fear that tends to develop for the person with OCD, this backdoor spike that all of a sudden there's something wrong with not having anxiety about those obsessions anymore. So long answer short, yes, everything you're talking about is very common with OCD. We see it all the time. Is it also normal to feel like you want the thoughts and that you want to do them even though you know you don't want to? Yes, this is one of the other tricks of OCD. It is because, once again, the obsessions themselves are so repetitive and so persistent, people start to fall under this kind of false belief that this might actually be something they want to do. But you touched on the important point. Deep down within yourself, you know you do not actually want to do that thing, commit any sort of harmful act, whatever it may be. Is it okay to not think about HOCD, and even that I feel recovered, I still get false attraction, which makes it more confusing if it is or not HOCD, which scares me somehow, and I'm not getting any anxiety. I know what you're talking about here. So again, for anybody out there who may not be familiar with some of this terminology, HOCD is a term that refers to what is often known as homosexual OCD. We actually usually call it sexual orientation OCD, because what we're learning is that these types of intrusive doubts regarding one's sexuality can really occur for anybody of any sexual orientation or any gender identity who just happens to have OCD as well. So yeah, I think it's okay to not think about the HOCD. Again, one of the traps people get stuck in with OCD is thinking about what's going on for them so much. And that act of constantly thinking about reviewing their own thought processes, what we call this kind of excessive analysis, and that analyzing their own mind, trying to figure out exactly what all this stuff means, that very much becomes a compulsive process for people. We do consider that a mental ritual that people can go through. You may think of it as just obsessing or overthinking things a lot, but we call it figuring it all out. It's this excessive analysis, like I said, of what is going on for the person. So quite frankly, yeah, it's okay not to think about. As far as this term false attraction you're referring to, there's often an anxious arousal that people with HOCD and all forms of OCD, honestly, can experience. What's happening for the individual, usually they're so afraid to actually experience true physical, what people might term intimate or romantic arousal, that physical arousal towards someone or something else. They're so afraid that might occur. It's actually causing this anxious physiological sensation in the body that feels like a physical arousal, but it's actually anxious arousal. So that can still occur. The important thing here, once again, is to learn that just because you're experiencing those types of sensations, what feels like some sort of arousal within your own nervous system, it doesn't have to mean anything. And I'll talk about this more probably as we go through this, depending on the types of questions we get. But one of the most important things people with OCD can work on is starting to kind of detach all the meaning that they are prone to attach, like I said, to their different kinds of thoughts, any feelings, physical sensations they're experiencing. It's this ongoing kind of overinterpretation, trying to analyze everything, figure out what everything means. And to me, one of the dirtiest tricks of OCD is that none of it actually means anything. If anything, it just means that you have OCD. But one of those nasty tricks of the OCD cycle is, even though the answer is right in front of your face, that everything you're experiencing and wondering about is related to the OCD is trying to make you think it's something other than what it actually is, which is just the nature of the disorder itself. So very good questions so far. As always, I appreciate people being just very open about what they're experiencing and being willing to reach out and ask these kinds of questions to learn more. What direction should I take if I'm obsessing about doing the right exposures? If I don't do exposures right, how can I get better? How to avoid exposures becoming a compulsion? Thank you for that. This is yet another very common phenomenon that can happen for people trying to go through exposure and response prevention work to help them with their OCD. I know this is a lot easier said than just believed or put into practice, but there's no perfect way to go about treatment. There's no perfect way to go about exposure and response prevention. And these concerns you're listing here, a lot of people get way too caught up in this. Am I doing each and every exposure exactly right? Am I recovering on this perfect trajectory that, quite frankly, does not exist? When people are working on trying to overcome their own OCD symptoms, it's not going to be this clear trajectory where things are just steadily getting better and better and better, and everything feels great and just right. More often than not, it's kind of this up and down process. It's very common for people to lapse back into compulsions when they're going through ERP. So one thing I want to take a minute to talk about here is when we're talking about exposure and response prevention, a lot of people seem to understand the exposure piece, which can sound a little frightening. A lot of people say they're kind of reluctant to engage in ERP because they have enough understanding to know that exposures do entail you purposely facing things that cause some fear or anxiety or discomfort for you. The really key piece to treatment here is the response prevention. So don't get daunted if you're worried about the exposure piece. The goal here really is for you to learn and teach yourself that you can actually be exposed to something that is anxiety provoking, yet you can still prevent your typical response. You can prevent your compulsions. It's not easy, but it can be done. And here's why we really, really emphasize the response prevention piece. This is absolutely vital if you're going to work on trying to better manage and overcome your OCD symptoms. It is only by teaching yourself that you do not have to, and will start to truly learn that all these different obsessions you've been struggling with are not actual threats. They don't pose any risk to you. They're not an actual risk to your safety or anybody else's safety. They're not an actual risk to your identity, your sense of self, your sexual orientation, your relationship, whatever it may be. These are just thoughts. These are just images. These are just urges. But again, the only way for your brain to engage in new learning, to truly understand that, is to actively and consistently resist your compulsive urges. So if you find yourself getting caught up in this process of trying to do exposures just right, to me, that sounds like the OCD kind of interfering. And I know this may sound strange to some people. Hopefully enough of you will relate to this when we talk about OCD in these terms. But OCD is like this strange thing that coexists in your brain, and its job, if you will, is to try and stick around and pester you as much as it can. So many times the OCD itself kind of plays this trick on people, trying to make them have these fears or concerns or worries that they're not recovering perfectly. They're not getting each and every ERP exercise they're trying just right. So if you are someone who has not already worked with an OCD specialist who really understands the ins and outs of ERP and can help you come up with really effective exposure ideas, help you come up with strategies to help you better learn how to resist your compulsive urges, I really do encourage you to reach out and find an OCD specialist who can help you with the ERP process, kind of be your guide along the way, give you feedback on your progress in treatment, and help you in areas like this where you might feel a little bit more stuck. So once again, that's a great opportunity that NoCD offers, meaning you can work with an OCD specialist who really understands the ins and outs of ERP and will take the time to understand your specific symptoms and understand the things in your life that are causing you that amount of distress and continuing to create those compulsive urges, and help you develop strategies, like I said, to resist any compulsive urges that arise out of those fears and doubts. All right. As usual, more and more questions flowing in here. What is the success rate for completely getting rid of OCD? Awesome question. And this is an area where I've been doing this long enough. I've learned it's most important if I'm just really straightforward and really blunt about this stuff. I totally appreciate the desire to get rid of OCD completely. People don't like feeling anxious or distressed or flat out scared. They would like to be able to get rid of those feelings. They would like to be able to get rid of their obsessions, have them never occur again. That sounds wonderful and amazing. Unfortunately, it doesn't happen. You cannot completely get rid of anxiety in the same way you can't completely get rid of OCD. You can't completely get rid of stress even. These are things that you need to learn how to manage. And the reason I'm pointing this out is because there are literally millions of people who do learn how to effectively and consistently manage their OCD symptoms to the point that those obsessions, any distress that might continue to go along with it to any degree, is not interfering with their lives in any way, shape, or form. The people I've worked with who have had the most success in overcoming their OCD symptoms will be honest in that, yeah, they still have intrusive thoughts from time to time. They still get these images. They may have moments in time when they're still completely racked with doubt or guilt or whatever it may be. But the bottom line is those different triggers are not causing nearly as much distress. They're not impairing their functioning in any way like they used to in the past. And once again, the person has taught themselves not to engage in any sort of compulsive process. So the OCD is still there. And even though people really don't like hearing this, the OCD will continue to be there. But it doesn't mean that it has to interfere with your life to any degree. It doesn't have to negatively impact your functioning. It doesn't have to negatively impact your sense of self-worth or your sense of confidence or any of those things. So the reason we keep on recommending ERP for OCD time and time again is because over 50 years of research at this point shows us that this is the most effective form of treatment specifically for OCD. That's why we call it a first-line evidence-based treatment for OCD itself. As far as that goes, the success rate, the numbers are pretty phenomenal. I can't give you exact percentages, but I know I've read enough research studies at this point that on average, people report something like an 80 to 87% success rate with using ERP specifically for OCD. So that success rate means the person has learned to manage their symptoms in a way that they're essentially a non-issue in their day-to-day life. It doesn't mean it has completely gone away. This is also important to remember because if even if you're well into recovery, you feel like you've got this thing under a pretty decent control, but you're still holding on to this hope, this desire, maybe even this belief that it will and can go away 100%. That usually doesn't occur. And people tend to feel better, have more of a sense of peace and calm in their life if they truly learn to accept the OCD may still be there to some degree, but it doesn't have to impact anything in my life anymore. So hopefully that started to answer that question a little bit. Are themes of OCD like religious OCD harder to treat? That's a good question. In my opinion, and for whatever it's worth, I think at this point, I have seen pretty much every theme of OCD that is a more common theme. Things like scrupulosity, like you're mentioning. There can be a religious scrupulosity, moral scrupulosity. A lot of people struggle with what we call existential OCD. And I do not think that any one theme or any one type or subtype of OCD is harder to treat than the others. What seems to make a really huge difference in treatment and how effective treatment is for an individual is the individual themselves. I know this is really challenging work to do, to learn how to manage and overcome your OCD symptoms, but people who somehow, some way dig deep, find that motivation and that willingness to really work hard on teaching themselves how to eventually stop their compulsions, any kind of ritual, those are the people that tend to do the best and feel the best when it comes to treatment. So personally, I don't think any one theme of OCD is harder to treat than another. And I know many of my colleagues who are also OCD specialists would also agree. Is it normal to constantly feel like everything is going bad? Sometimes my brain races over and over and I can't calm it down. Yes, with OCD, totally normal. So this kind of falls in line in what I was touching on earlier, in that part of the nature of the disorder of obsessive compulsive disorder, this is a neuropsychiatric disorder we're talking about, is this ongoing kind of false belief, this almost false alarm, we usually call it in the brain, that something is going to go bad. If there's no immediate threat right now in front of my face, something is going to go wrong. Many people with OCD describe this feeling of just ongoing uneasiness. Along with that, people will describe this sense of hyper awareness. And this is kind of a dysfunction of the anxiety response in our brain. So every human is born with a fight, flight, or freeze response that's just housed in our brain. It is designed, when it's working correctly, I guess, the way it's supposed to keep us safe when there is an actual danger, when there's a real threat to our physical well-being. But unfortunately, with something like OCD, because it is a neuropsychiatric disorder, that alarm signal in the brain kind of malfunctions, and sometimes it misfires. And that is part of the trap, once again, of OCD. Your brain is really sending out messages that something's wrong. Something is a threat. Best example being many people perceive their own obsessions as some sort of threat. Or even if people get to the point where they can recognize in the moment, all right, that's an obsession, that's just a thought, that doesn't have to mean anything, I'm not in danger here. There's this lingering sense, because of kind of the overactive anxiety response within the brain, that something is going to go wrong. So for that reason, a lot of people describe feeling like they're just kind of always on the lookout, kind of always scanning their surroundings, maybe again, scanning their own brain, scanning their own body to see how it feels, always a sense that something might go wrong or is about to go wrong, and they have to be prepared. They have to be on the lookout for it. So yes, with OCD, it's normal to constantly feel like everything is going bad or will go bad at some point. But again, ERP has been shown to be highly effective in helping people engage in new learning. So they start to see time and time again, just because this anxiety response may be going off, it does not actually mean that they are in any sort of danger. There's no actual threat in front of them. Is medication the right thing to do? Totally depends on the individual. If it helps, I can tell you currently the American Psychiatric Association guidelines for best treatment for OCD is for an individual who's not already on medication to actually try ERP first. And again, numbers are kind of all over the place here. Some people just do ERP with some CBT, cognitive behavioral therapy, and that is enough for them. It's just the way their brain happens to be working. That's enough for them to learn how to manage things. Other people, maybe the case is just a little bit more severe. They're really trying ERP. They're giving it everything they can in treatment, but it's just not quite enough. In those cases, the American Psychiatric Association guidelines are to go ahead and try medication along with ERP. But here's the important point to keep in mind. The top two recommendations are to try ERP or ERP plus medication versus just medication alone. There are people who just go on medication for their OCD and do have some positive responses to it. But there are also those people who then later on, even if they've been on medication for years and they feel like things are generally okay for years, they actually decide to try ERP anyway, and they will tell you, and research shows at that point, they demonstrate even more progress in overcoming their OCD symptoms. So hopefully that helps. We always recommend trying ERP first, maybe ERP plus medication, depending on how the person's responding to treatment. Those are your first two best bets before just trying medication all by itself. Is it part of OCD to get into your head? Yes. And the compulsive thoughts and lose track of time. Sometimes when I'm anxious and having a flare-up, my days get away from me. Yeah, thank you for bringing that up. Totally. I have heard that. I don't even know how many times over the past decade or so as I've been working with people with OCD. This is how powerful the obsessive compulsive process can become within the brain. It takes so much mental and cognitive energy. It's hard for people at times to really even have much awareness of anything else going on around them. So kind of like you're saying, I've worked with tons of people over the years who have said they feel like they just lose hours. They lose entire days just caught up in some sort of compulsive process. And especially when you're talking about mental compulsions, any kind of mental rituals you might be going through, unfortunately, it's even easier to lose track of time in that way. I've had people tell me, they will have a really intense obsessive trigger of some sort. They will start going through some sort of mental compulsion, all of a sudden look at the clock and realize it has been 5 or 6 hours. Literally. So this is, again, how powerful the brain is. It's almost like this tunnel vision. Because of the OCD itself, people are going through this compulsive process in some sort of attempt to try and get relief, try and find some sort of magic solution that's going to explain everything and fix everything, or just trying to make those obsessions go away once and for all. And people can put so much effort and energy into that, just trying to get that relief, trying to get some respite. They do literally lose track of time. So that is not uncommon. And I thank you for sharing that. I no longer really have intrusive harm thoughts, but I'm now more so wondering if I'm ever going to act on the thought since I had it in the first place. Is that thought action fusion? Yes. Yes, that is thought action fusion. So for those of you out there who are not familiar with this terminology, thought action fusion is one of the most common phenomenon we see in OCD. Simply put, people with OCD tend to fall into, once again, this false belief that simply having a thought is as bad as committing some sort of act. So we see this a lot with harm OCD, pedophile OCD, for example. So people experience some sort of intrusive thought or image about them maybe committing some sort of act they really don't want to do. They, again, know deep within themselves, kind of goes against their true nature. And that is why the nature of that thought is so distressing. But many people with OCD equate just having that kind of thought or image with being as bad as committing that act itself. Or, like you're pointing out here, having a thought means I am going to do that thing, whatever it may be. That's thought action fusion. Another way to think of it is people are, again, just interpreting obsessions in a way that they do not need to be interpreted, meaning having bad thoughts means I am a bad person. So again, attaching some sort of meaning to it. Simply experiencing thoughts means they're going to follow through with some horrible act, or they are in fact a horrible person or a monster or any of that stuff. The bottom line is that none of it's true. You can think something all day long. It does not mean it's going to come true. A common example we often use through our NoCD treatment model is directly challenging this for people. So we would have people kind of verbalize some of their thoughts, verbalize some of their fears, as difficult as that can be sometimes, and then just flat out see if that comes true. You can think something all the time. It doesn't have to mean anything. I can sit here right now and tell you that I am wishing and hoping and thinking about and picturing myself punching myself in the face. And I could sit here for the rest of this webinar, the rest of the night, the rest of my life, thinking that and picturing myself doing that. Doesn't mean I'm actually going to do it. Doesn't mean it's ever going to happen. Doesn't mean I truly want that thing. It's just a thought. It's just an image. But I know that is a very, very difficult and challenging lesson to learn when you're trying to manage OCD. Almost 3 months ago, I quit my meds and I'm currently experiencing health anxiety. Can a person start to have certain symptoms about certain diseases just by reading about it? Yep, definitely. We often say that OCD can be pretty suggestible, meaning people may learn about something that produces a little amount of fear or discomfort, or it seems kind of uncertain to them. And that's just enough of a trigger for the OCD to kind of jump all over it and latch onto it. Oh my gosh, maybe I have this thing. Maybe that will be an issue for me. So long answer short, yes, this can happen. And again, this is how powerful a brain is. People may think about experiencing a certain sensation or symptom enough and so much that it actually starts to kind of feel like they're having that very symptom or sensation they are afraid of experiencing in the first place. And once again, I know I've said it a bunch already, but that's the power of the brain. So essentially what's happening here is when you're thinking about some sort of potential health symptom, or again, thinking about some sort of arousal or sensation, and especially if you're thinking about it in a particular area of your body, even as you're starting to have that thought, your brain is actually sending signals to that area of your body. So I'm thinking about my right index finger right now. And my brain, even before I could finish that sentence, probably before I got 2 words out, had actually already sent signals to my right index finger. So that's the power of the human brain. And yeah, OCD can be a little bit suggestible at times. People can kind of adopt those additional fears simply by learning about something. OCD still grabs me, even though I'm working really hard with a great therapist. I get a bad thought about death and numbers and feel like I need to rewind by redoing whatever I was doing when the thought happened. That's very common compulsion, just so you know, in case you aren't aware of that. The way you put it, feeling like someone has to rewind. It's kind of falling into this idea that they can't follow through with any sort of act, whatever it may be, if there is a quote unquote bad thought in their head. I can't have that thought be in my mind while I'm doing this thing. Otherwise, then something bad really is going to happen. So let me stop. Let me rewind. Let me reset. Let me do the whole thing over again. And I'm guessing, I don't know for sure, but maybe you're trying to follow through with that act, whatever it may be, while simultaneously having a good or pleasant thought or image in your head. So one thing I'll say here, and I know this probably sounds nitpicky, but it's actually really important in kind of gaining a different perspective on intrusive thoughts. A bad thought really only has to be a bad thought if you are telling yourself it's a bad thought. I think in the long run, it's going to be much more productive and probably feel better to you if you can get to the point where you can call that thought out for what it is. It's just a thought. A thought doesn't have to be bad unless we, as the human being, are saying it's bad. So we are the ones that are attaching meaning to it. Once again, thoughts are thoughts, images are images, urges are urges. They don't have to be bad. They don't have to be good. It's really up to you and kind of your perception. And again, believe it or not, going through ERP can help you start to develop a new perspective on your own thoughts and images that you might be experiencing along with the OCD. Is it normal to be obsessed with numbers with OCD? Yes. Do you have any experience with treating postpartum OCD? Yes. And I'm glad that each of you brought up these points. So a lot of people with OCD get fixated on numbers. First of all, I'll go back and address that one. And it can be in any way, shape, or form. It's kind of like what I was just talking about. People start to form this idea that certain numbers are good and safe and other numbers are bad. And if they experience, they come across that number or they're doing something that number of times, once again, that means there's going to be some sort of negative outcome. Something bad is going to happen as a result. And then over time, people develop kind of safe numbers. So that can directly translate to compulsions, feeling like you have to go through a certain act a certain number of times. Or maybe it's just an entirely mental process. There's so many different mental compulsions that people get stuck in, feeling like once they experience an intrusive thought or image, they have to count to that certain number, that safe number, and only then will things be okay. Only then can they experience some relief, and maybe the obsession itself will fade away for a little bit. As far as postpartum OCD, I'm really glad you brought that up. This is yet another very real phenomenon that does occur for people, unfortunately, and I think there's just too little education and understanding out there for it. So with postpartum OCD, what tends to happen is that usually within moments of giving birth to a child, one of the parents starts experiencing a relatively rapid, sometimes severe onset of obsessive compulsive disorder symptoms. And this can happen even for people who have no prior history of OCD, no past history of obsessive compulsive tendencies, maybe a little bit in the way of some anxiety prior to the pregnancy and childbirth, but nothing that would be full-blown OCD. Or people do have a history of OCD. Some people are fully aware they have OCD. They've gone through treatment for it, feel like it's very well managed, and then shortly after the birth of a child, there's an exacerbation of OCD symptoms. What happens a lot of times, unfortunately, once again, is that with postpartum OCD, the intrusive thoughts, images, urges, doubts, all that kind of stuff are attached to the newborn infant that the person has just had. And many times, it's a little bit different for everybody, but many times the intrusive thoughts are somehow directly or inadvertently causing harm to their own child. A lot of people kind of experience what we would call pedophile OCD in kind of the framework of postpartum OCD, meaning those types of intrusive thoughts and images are of them actually molesting or doing something sexually inappropriate with their own newborn. Again, doesn't mean that's a real threat, doesn't mean the parent is ever going to act on that stuff. And again, these types of obsessions tend to cause high amounts of distress and anxiety for the new parent because they know on some level this is not anything they would ever actually want to do or try and follow through with. So we're still researching postpartum OCD, trying to learn more about it. So here's kind of an interesting phenomenon with mothers who have just given birth. We know that there is a pretty significant shift in hormones that occurs right after delivering a child. There seems to be something about that hormonal shift that could potentially bring about an onset or at least an exacerbation of OCD symptoms. Also, we know that there seems to be some connection between stress and OCD. And even though having a new kid can be great, it can be a wonderful experience, it is a stressor. It's kind of a positive stressor, but it's a significant stressor. All of a sudden, there's a human being that you are now responsible for keeping safe and keeping alive. So there seems to be some combination of that hormonal shift, along with this being a new stressor introduced into the life, that can create, again, this either sudden onset of OCD symptoms or an increase in the severity of pre-existing OCD symptoms. Here's something else that is actually, unfortunate, but also fascinating. This doesn't just have to happen to new moms who've just actually physically delivered the child. We see this happen with new fathers too, especially if they happen to be present for the birth of their child. There's enough research that shows us that even new dads experience a shift in their hormones upon the birth of a child. And once again, there's this stressor piece. Again, wonderful experience for many people, but also a significant stressor that's just been introduced into this person's life. So it can happen for a new mom, a new dad. It doesn't have to be the first kid they've ever had either. It could be the second, third, fourth, 12th kid, whatever it may be. So yes, I have experience with treating postpartum OCD. One of the really wonderful things and rewarding things I get to do as part of my role with OCD is I conduct all the trainings for new therapists that are coming on board to work with us. And anybody who's gone through that training with me will tell you, I talk a lot about postpartum OCD because I think it's so important that we have increased awareness about it. So I guarantee you, if you work with anybody on our staff at OCD, any of our OCD specialists, they will have at least a solid understanding of what postpartum OCD, and most of our therapists do have some experience treating postpartum OCD as well. So if you're asking directly for services, if you think it's something that could benefit you, again, don't be afraid to click on that link below down at the bottom of the screen, set up a free intake call, get to learn more about our program and what we can provide for you. There really is effective help out there. I think OCD is providing some of the most effective help that's available in our country currently, honestly, for OCD. So again, any of you out there, don't hesitate to reach out, learn more about what we could potentially help you with through this amazing organization. All right, is it normal for existential and self-harm OCD to mix together? Yep. I try to figure out if the life has a meaning, and then think, if life has no meaning, what stops me from doing something bad with myself? Thank you. I mean, I know I've thanked everybody, but I really appreciate you bringing this up as well. And again, being so honest about what you're going through. The answer is yes, it is normal with OCD. And I'm noticing this is a common theme with a lot of your questions. Is this normal? Is this normal? Is this normal? With OCD, yes, everything you're all describing is very common when it comes to this disorder itself. So yes, we see this interesting, but I know also upsetting crossover between existential and self-harm OCD. It can be just what you're talking about. People start to fear, if there is no meaning to life, then what's the point of being around? And then, whoa, does that mean I actually want to do something to myself? I've worked with people that have expressed things along the lines, what exactly happens after we die? And this becomes kind of the content of their obsession, if you will. And people are experiencing a lot of anguish because, quite frankly, there's no set answer to that question, right? So much of the fear and anxiety that goes along with OCD is just an extreme amount of difficulty tolerating any amount of uncertainty. And if you want to start thinking about what could potentially be the ultimate uncertainty, it's what happens after we die, because we have nobody who can tell us definitively, beyond the shadow of a doubt, this is exactly what happens after you die. So along with that, my point is sometimes that will become kind of an obsessive focus for people, and then it crosses into these self-harm, suicide, OCD fears and doubts and obsessions along the lines of, am I so curious about what exactly happens after we die that I'm actually going to kill myself to find out? None of this means that any of you want to die. None of this means that you would actually try and follow through with that. It is a fear. And again, this is kind of the nature of OCD. It produces a lot of doubt, so much doubt that there is a lot of fear that goes along with that. When people are experiencing that amount of doubt day in and day out, almost hour by hour, minute by minute, creates so much uncertainty that, yes, there's just kind of a natural fear and anxiety that goes along with it. If thoughts, feelings, and urges aren't real, what's the best way to determine your values, and how do you commit that to your actions? How do you commit that your actions are following the values? Okay, so that's an excellent point. Let me think about how to address this one. So I would say the thoughts, feelings, and urges that go along with OCD aren't real, in that, once again, they don't have to mean anything. And I will do my best to answer this, but I feel it's important to preface this with kind of explaining the nature of intrusive thoughts and doubts in general. So every human being has doubts to some degree, at least at some point in their life. There is some absolutely astounding research that has come out just over the past decade or so that shows that roughly 90% of people, and this is people even without OCD, we're just talking human beings, people, up to 90% of people in general experience intrusive thoughts, experience intrusive images or doubts. I'm very honest with people. I let everybody out there know. I have no problem saying it. I don't have OCD, but I certainly experience intrusive thoughts and images. I can think of a bunch I've had over the course of my lifetime. Sometimes they're related to me. Sometimes they're related to my family, my friends, my loved ones. It's usually something that I do really care about, and it's meaningful and important to me. But I recognize those are thoughts. They don't have to mean anything. Doesn't mean I'm a terrible, horrible person. Doesn't mean I have to do anything about it. I don't have much of a strong emotional reaction to it because I'm not interpreting it in a certain way. So when I say thoughts, feelings, urges aren't real, that's kind of what I mean. Yeah, people experience them with or without OCD. People experience this stuff, but it doesn't have to mean anything. And it certainly doesn't have to mean kind of these extreme fears or these extreme beliefs that so many people jump to. Things like I've already mentioned, I must be evil, maybe I'm a sociopath, maybe I am truly a pedophile, whatever it may be. So the best way to determine your values, that's kind of a tough one because that's totally based on an individual basis. I would recommend, if you're not already working with a therapist, with an OCD specialist, that is someone you could kind of brainstorm with. You could receive some education on common values that people tend to uphold. Really, when I think of a value, it's anything that provides us with a sense of purpose, anything we find meaningful or fulfilling or rewarding in our lives. So really, in treatment, you want to work towards your values, no matter how many doubts, thoughts, urges, feelings, all that stuff. You don't want to give in to those uncomfortable feelings. You don't want to give in to obsessive fears. So if you are able to clearly identify what your values are, then I would encourage you to just move in the direction of those values, whatever is meaningful and important to you, even if these intrusive thoughts, fears, urges, doubts, whatever they are, continue to pop up for you. So I hope, I know that wasn't super specific. I really think those are best identified on an individual by individual basis. And I'd really encourage you to work with an OCD therapist to really clarify your own values and what's important to you in your day-to-day life and in your life as a whole. So I lied about something and my OCD is torturing me. Can you give me tips on overcoming it? Yeah, okay. First of all, I'll say go a little bit easy on yourself. I think most people lie to some degree. I know I've told bold-faced lies in my past. I've told little white lies. People, for some reason, sometimes just have a hard time being fully and completely honest. So first of all, a little self-compassion, a little forgiveness here. Everybody lies. I think really this is something, and I could see the OCD jumping all over. Sometimes this turns into what many people refer to as either real event OCD or real life OCD, where they have actually experienced something in their lives. Maybe they have been responsible for something that's a little bit uncharacteristic of them that they're not proud of. And then that becomes the obsessive focus, right? It's the OCD trying to convince you once again, this really means something awful about you as a human being. You must be a terrible person who is irresponsible and doesn't care about anybody else. None of that's true. It's just a bunch of lies that your OCD is throwing at you. So don't let the OCD lies influence you too much and make you actually feel bad about any lie you might have told. So I know I'm pushing this a lot, but believe it or not, there are actually methods within ERP that could help you learn to tolerate not just anxiety, but other powerful emotions like guilt or shame or embarrassment. So again, I don't know you. I'm not your therapist, but if you were working with me, I might give a suggestion like, okay, let's take the lie itself, or let's take some of the OCD related lingering doubts or fears about the fact that you told that lie, and let's turn that into an exposure. Sometimes you can do what are known as thought exposures. You can take a specific thought, a specific obsession. You can even do it with an image. You can do it with a real event, something you actually have said in your life. And you write that thing out, or you type it out. You record yourself saying it so you can listen to it in your own words. And you actually want to maintain focus on that trigger itself and work really hard. I know it's not easy, but work really hard on keeping yourself away from any sort of compulsive reaction. So there's something about actually purposely focusing on things that tend to cause us distress or anxiety, or even something like shame to a degree. If we stay purposely focused on it, and we're not trying to distract ourselves from it, we're not trying to avoid it, run away from it, get immediate relief from it, over time, that thing, whatever it may be, starts to lose its power anyway. The brain starts to get a little bit bored by it. And once your brain is bored by something, there's not much of an emotional reaction to it anymore, because your brain has started to learn this really important lesson. That thing is no longer a threat. And once again, like I've said a billion times already, that thing doesn't have to mean anything. So hopefully that helps just a little bit. When my ROCD is triggered, it often makes me feel upset or angry at my partner, even though I know it's not really his fault. Any advice for how to reduce this? First of all, kind of my first line recommendation for people that are asking these kind of questions, how to best cope with this. Once again, if you're not already working with an ERP therapist, an OCD specialist, please find someone. You can start with us here at NoCD to help get you pointed in the right direction. The reason being because everybody with OCD obviously is unique. Everybody's just a little bit different. What's going to be most constructive in your long-term success is working with an experienced treatment professional who understands OCD, who's willing to learn about your specific symptoms, your specific triggers, to better understand them in a way to help you design really specific exposures for those symptoms and the things you want to try and work on and overcome in your life. So here's the thing. Here's what happens time and time again with ROCD. And again, if anybody out there isn't familiar with this term, it stands for relationship OCD. OCD itself causes intense emotional reactions. I don't have to tell any of you that. A lot of times people get frustrated or angry or upset with the OCD itself. They'll get angry that these intrusive thoughts and fears and doubts keep popping up over and over and over again. They might get really, really frustrated that they keep falling back in compulsions when there's some part of them that knows they really don't want to do that thing. Going through the process of a compulsion isn't really pleasurable. It's not really enjoyable. It's just a means to an end, right? Trying to get through this compulsive process to obtain a sense of relief, something like that. So many times when OCD symptoms kind of manifest themselves through an obsession or a compulsion or both, there is that intense emotional reaction. And many times that frustration, that anger can be directed towards other people. When it sounds like, and I don't know for sure because I don't know you personally, but it sounds like you're probably frustrated and upset with the fact that you're having intrusive doubts about the relationship in the first place. So here is one of the nastiest things about ROCD. Many, many times, I would say a vast majority of the time, it's not the relationship that's the problem. It's not the partner that's the problem. It's not you that's the problem. It's the OCD that's the problem, trying to convince you that something might be off or wrong or not as optimal as it could be otherwise in that relationship. So that's a tough one as far as how to kind of redirect yourself. I don't know if this makes any sense at all, but if you find yourself getting angry or upset with your partner, even if that process has already started, maybe you've already said something that indicates you're angry or frustrated, and it seems like you're angry at your partner. If they're supportive and willing to help you with this, maybe they can help you redirect that anger and frustration back at the OCD. And that can sometimes be motivation, believe it or not, to really even work harder on managing your compulsive reactions and not giving into these obsessive doubts and fears. So I know that might have been a little bit vague, but again, I really truly mean this when I say it. I think it is so important that you work with someone who really understands the ins and outs of your specific symptoms so you can address them in the most effective possible way. All right. Does harm OCD usually come with external compulsions like hand washing? I have harm OCD, but I don't connect my compulsions with the thoughts. Yeah, that's a great question. Even though there are these different types and subtypes of OCD, there are these different themes that people tend to experience with their OCD. It's not like compulsions only fall into one category. So you don't just have to struggle with contamination OCD and fears about, contracting some sort of disease or being responsible for spreading germs to others to engage in a compulsion like hand washing. Many people with all different types of OCD do not like the feeling that occurs when they're experiencing obsessions. And like I was just talking about, it can be anxiety, usually is. It can be some amount of discomfort, distress, anger, frustration, all these different things. I've worked with tons of people over the years who this wasn't contamination OCD, but they would say things like they were disgusted by their own obsessions. That happens a lot with harm OCD, happens a lot with something like pedophile OCD as well. People are literally disgusted by that. Sometimes with scrupulosity, people are afraid that they have experienced an impure thought, and that makes them feel unclean or impure, obviously. And so in those cases, that experience can be intense enough that people actually go to some sort of outward physical washing or cleaning behavior simply in response to the obsessions, even if it has nothing to do with cleanliness, germs, any of that stuff whatsoever. So I don't know if that type of compulsion is happening directly in relation to your harm OCD related intrusive thoughts, but it's something to consider. There's a good possibility that actually could be occurring. All right. There's so many coming in. I always try and get to these, and I'm already where we're getting short on time. So let me hit on a couple of these before we have to wrap things up. How do you sit with the thought that you might harm yourself? Wow, awesome question, because this is something that would actually be recommended usually as something along with ERP. The idea would be to actually allow yourself to experience that obsession and literally identify that specific thought, I might harm myself, and make every effort to resist any sort of compulsive urge that might arise from it. The reason being, if you're able to teach yourself that you can sit with that discomfort, you can just kind of withstand that distress and any other intense emotion that might go along with that type of thought. If you can withstand that long enough, chances are the intensity of that emotional reaction will start to fade without you doing anything about it, without you actually engaging in a compulsion, trying to get some relief, trying to get away from that kind of thought, if you will. So I know this is really, really challenging to do, and ERP is tough work, but it's very rewarding work. If you were to allow yourself to sit with that long enough and experience some decreased intensity of your discomfort around it, and also learn the lesson that you can experience that thought all the time. And once again, it doesn't mean you're going to do that thing or you want to do that thing. That is usually a really powerful lesson for your brain to learn. You're learning a couple different things, like I just touched on. You can experience any kinds of thoughts, as unpleasant as they may seem at the outset, and the emotional reaction to it can fade over time without you seeking immediate relief from it. And like I said, you can also learn, you can experience those kinds of thoughts and there aren't any negative consequences to it. Doesn't mean you're going to follow through with that act. So how do you sit with it? I'm kind of old school and draw a hard line when it comes to ERP. I'm going to tell you, you just sit with it. You just kind of grit it out, because that is really what's going to help your brain learn. If that's not working for you, I know once again that is extremely difficult, especially if you're not like in a structured program, if you're not working closely with an ERP therapist, if you feel like you don't have clear guidance on the rationale for trying that sort of thing. But if it's hard for you to just sit with it, but you really want to work on resisting some sort of compulsions, sometimes we recommend finding something constructive, again, meaningful, fulfilling to you that you could do while also actively allowing yourself to have that thought just be there. The idea, once again, is I can have this thought, I can picture any kind of image, and I can still follow through with some sort of activity that actually feels pretty good and useful and constructive to me. Now, there's kind of a fine line there, right? Because we don't want those healthy activities, things that you actually enjoy and find meaningful, to turn into compulsions. That happens now and then. So again, this is why we really emphasize it is so important to be working with an OCD specialist, someone who gets to know you one-on-one and can help you kind of troubleshoot if a ERP work is not going the way you were hoping it would, or if you're just finding it really challenging to sit with the discomfort that goes along with some of these different obsessions. So in the interest of time, let me find just one more here, and I'll do my best to answer that for you. This is probably a good one to end on. So it's a two-part question. I'll talk about the second part first. So are there any common traits that make a person more likely to recover from OCD? Great question. Do comorbid conditions like eating disorders make recovery less likely? As far as the second part, I'll start with that. Do comorbid conditions like eating disorders make recovery less likely? No, I don't think so, because I think it actually comes back to the first part of your question, which is, are there common traits that make a person more likely to recover from OCD? I don't know if it makes them more likely to or not, but I can tell you kind of the key factors it takes to really feel like you have successfully overcome something like OCD or any type of eating disorder or any kind of comorbid condition we often see with OCD. It could be generalized anxiety, it could be some amount of depression, panic disorder, whatever it is. Some of the key factors for people who feel like they do have more success and have truly overcome those types of symptoms: motivation, knowing that it is going to be hard work, but trusting that there will be a positive payoff at the end. So along with that, that willingness to demonstrate strength, courage, whatever it may be that it takes to kind of push yourself through the challenging work of therapy when it comes to managing OCD. And the last thing I'll say along those lines is, in my experience at least, and I know many of my colleagues agree with this, people with OCD, as well as eating disorders and other types of behavioral health issues and mental health issues, they're just way too hard on themselves. You guys are probably just being way too hard on yourselves. You're not really giving yourself that much credit. And people are often surprised at how well they do in treatment because they had simply never given themselves the chance to try and tolerate some discomfort, to try and actively change their behaviors in the past. But once people do that, maybe with a little guidance and encouragement from a treatment provider, hopefully some loved ones, a positive support system, whoever it may be, like I said, people kind of surprise themselves, and people truly learn they are capable of far more than they ever thought they were previously. So even if it's scary, even if it feels uncertain, to actually reach out, take the first steps to get that help, I really encourage you to do it. I can tell you time and time again, ERP works. I see people kind of work on their own negative sense of self-worth. They learn how to overcome that self-criticism, that negative self-judgment. They truly gain confidence in their own capabilities to take better care of themselves. So hopefully that helped out. I know there are a ton more questions, and we never ever have time to get to all of them, but just know that we do offer this live webinar every Wednesday night at 7 o'clock p.m. Central Time. So if I didn't get to your question tonight, please tune in each and every week if you can. If I'm not here, our head of clinical services here at OCD, Dr. Patrick McGrath, will be here to answer your questions. If it's not one of us, we've got so many amazing clinicians that work with us. We'll have somebody here who will try their best to field your questions and kind of point you in the right direction. Last thing I'll say, because this really, truly can help you. If you feel like I didn't get to your question, I didn't address some of your concerns, just reach out to us. The number's right there below the screen. All you have to do is reach out. You get a free phone consultation with a member of our care team here at the NoCD organization. They can answer additional questions you might have, get you hooked up with an OCD specialist who really truly understands the nature of this disorder and can really guide you on that path to recovery. I'm here to tell you honestly, because I've seen it so many times, it is possible to get better and stay better with OCD. So thank you very much for tuning in. Take care of yourselves, and maybe I'll see you at another one of these down the line.